Good morning, ladies and gentlemen. This is the parathyroid gland, Tuesday's lecture. So just want to make sure everybody's ready to go. Brooklyn, sit down, turn around, be quiet. Yeah. Maddie, shh. Yeah, I'm in Edmonton and I still know you guys are talking, especially Brooklyn. I tell you what, Brooklyn, Brooklyn, Brooklyn. Okay, anyways, parathyroid gland. It is day 6 on our schedule here, guys. Vocabulary is there for you guys to work on as well. Yesterday we looked at the thyroid gland itself, and this is the parathyroid section. These are 4 small glands that are attached to the thyroid themselves. The parathyroid gland are actually on the inside aspect of the thyroid itself. If you can imagine, this part of the diagram here is looking at the back of the thyroid, or from the back of the neck. Um, the isthmus here is what the point which 2 lobes connect to each other. Remember, the parathyroid glands are these little lobes that are attached here. These secrete parathyroid hormone. This is stimulated by low blood levels of calcium. And remember, yesterday we were talking about the effect of calcitonin on blood levels of calcium that's excreted by the parafollicular cells of the thyroid gland. Calcitonin helps to decrease blood calcium by building bone. Now, opposite of the calcitonin is the parathyroid hormone, and it stimulates an increased movement of calcium from the bone, retention from the kidney and intestines into the circulatory system. So the parathyroid hormone targets bone, the digestive system, kidneys, and its main goal is to increase blood calcium levels. Now, if we think about it, from the bone, robbing calcium from the bone to put it into the circulatory vessels doesn't seem like it's the best idea. For short periods of time, it makes up the shortfall. But over a longer period of time, you can imagine the bones will become weakened. They'll become a lot less able to support weight, and this term osteoporosis kind of comes to mind here. Digestive system, this stimulates us to retain more calcium from the food we eat, and the kidneys also retain calcium, more of the calcium, which is an electrolyte, or considered an electrolyte in our urinary system. Now, parathyroid hormone causes increased release of calcium from the bone caused by what's called osteoclastic action, or what's also termed as bone resorption. So it's not bone reabsorption, it's just bone resorption. This stimulates the kidneys to reabsorb calcium from urine as well, and it causes excretion of phosphates. There's an inversely proportional relationship between phosphates and calcium. As phosphates are excreted, calcium is retained. As phosphates are retained, calcium is excreted. Okay. So high phosphates, low calcium, low phosphates, high calcium. It's increased absorption of calcium by the digestive tract as well. Now, a condition called hypocalcemia can develop where a patient does not have enough calcium, causes muscle spasms, called carpal spasm as an example, causes muscle membrane to become unstable, potentially causes continuous firing of electrical signals rather than allowing the whole system to reset. A tetany or a sustained muscle contraction can also take place. It may also cause sustained laryngospasm and breathing muscle spasm leading to asphyxiation and death. So when we think about calcium, we really don't think about the muscles in our body, but they require calcium in order to contract and relax, to send the electrical impulse along our peripheral nervous system as well. The calcium, potassium, and sodium movement into and out of nerve passageways it's a requirement. Now, hypercalcemia, a condition of too much calcium, can take place. A parathyroidal tumor, which overstimulates parathyroid hormone, can release too much calcium, lead to this hypercalcemia. This stimulates osteoclastic movement of calcium to the blood. Bone pain can take place. People actually have aches in their bone from the movement of the calcium into the circulatory system. Excess calcium filtered through the urine can actually precipitate out as kidney stones. So this is why if patients have kidney stones, the physician often wants the patient to catch them in a little sieve or a screen so that they can be crushed and processed to find out what the contents are. High levels of calcium can potentially be a diagnosis for hypercalcemia. Depresses the nervous system and cardiac and gastrointestinal systems as well, leading to fatigue, bradycardia, anorexia, there's that word there, Maddie, and constipation. Now, the adrenal glands are the next set of glands that we're going to look at in this section. The adrenal gland is made up of a couple of different sections. The first one is the inner medulla, surrounded by a fibrous outer capsule, okay, called the adrenal cortex. So the adrenal medulla is an extension of the sympathetic nervous system. Essentially, it's where the hormone epinephrine and norepinephrine are manufactured and secreted, and elicits an adrenaline rush or the fight or flight response. It's classified as what's called a catecholamine. It causes elevation in blood pressure, so it's a vasopressor, increases heart rate, and in this case here, there is 3 effects on the heart: the inotropic, chronotropic, and dromotrophic effects on the heart. The chronotropic is the speed, increases the heart rate. The inotropic is it increases the contractile fibers contraction. It makes the ventricles contract harder. And the dromotrophic effect is that it decreases the pause time that the atrioventricular node affects on the whole cardiac cycle, so the cardiac signal travels through the heart a lot more rapidly. It, in essence, decreases the PR interval, if we've talked about the electrocardiogram. It converts glycogen to glucose within the liver. It takes some of that stored carbohydrate in the liver as glycogen, converts it to glucose. It increases metabolic rate in most cells. It causes bronchodilation. In other words, the passageways within our lungs open up. It causes vasodilation to the heart muscles, muscles, and vasoconstriction to the digestive system. We don't need to digest food when we are needing to fight or run away. So motility decreases in the stomach. That's why you get the butterflies in the stomach feeling. The adrenal cortex is the outer region, as opposed to the adrenal medulla inside. It secretes steroidal hormones. The glucocorticoids and mineralocorticoids. The glucocorticoids regulate carbohydrates, hence their name, glucocorticoids. Converts amino acids into glucose, so in cases of starvation or in cases of undiagnosed type 1 diabetes, they will stimulate the conversion of muscle into sugar. Helps maintain blood glucose levels between meals. The chief steroid is cortisol. It is also a stress hormone, and it's released in cases of high levels of stress. Acts also as an anti-inflammatory, and it's manufactured and administered to treat arthritis and allergic responses in medicine. Mineralocorticoids are the other type of steroidal hormone secreted by the outer adrenal cortex. It helps to regulate blood volume and blood pressure, so it will stimulate the retention of or excretion of water. Regulates salt, and again there it helps to, it influences the effects of the kidneys. It stimulates reabsorption of sodium and water within the kidneys, so it affects the level of blood the level of blood pressure and blood volume through the retention or secretion of water and sodium. And it eliminates potassium. That's that word that's hiding down below. You can't really see. Eliminates potassium. Now the sex hormones. These are secreted in small amounts. Estrogens and androgens. Estrogens are female, androgens are male. The pancreas is, I believe, to be done tomorrow. So for right now, that was a fairly short little video here. You guys are to have a look at page 115 in the Human Body and Health and Illness Study Guide, please. I'd also like you to have a look at page 254 through 257, and that's where we get into the pancreas, which will round us out and take us to the last section, day 8, gonads, thymus, pineal, and other hormones. So go ahead and get that reading done. Work on the study guide questions, and as well, you can continue to work on the recipe card mind map and research project as well during this time. Have a great day. We will see you guys on Monday.